Say hi to everybody.
Hi.
This is Daisy, everybody.
I feel a little better. And
Okay.
this is the first day.
We're going to get you there, okay? Hang in there. Hi, everyone. Dr. David Kulla here with, well, we won't say your name unless you want to say it. That's
Daisy.
up to you.
Fine.
What's that?
Daisy.
All right, we'll say it. Daisy. It's a lovely name, so why not? So Daisy here got referred by a old patient of mine, correct?
Elsie.
Elsie, okay. Yeah. And Daisy has sciatica, and you know, we're doing the exam, and I'm taking the history. I'm talking a little louder here because I have the mic near her, but I'm doing the history, and only to find out that she's been dealing with this for 5 years. Sciatica, 5 years. I can't even deal with it for 5 hours, let alone 5 years or 5 days for that matter. Anyway, most cases don't go away in 5 days, but 2% of sciatica cases require surgery. We want to make sure she's 98%, not the 2%. But 5 years she's been treating, and what have you been doing for it over those 5 years?
Physical therapy, stretching exercise, the ball, the TheraBand, BioFreeze.
All with a physical therapist, though.
Well, I alternated, like the physical therapy was the exercises, and then at home I do the BioFreeze and the ball and everything like that.
Okay. And you also said that you used a TENS unit as
well?
Oh,
yeah.
Okay. So for those of you that don't know, TENS unit is for pain. It tricks the brain into thinking you don't have pain, but it doesn't work for everybody. Did it work for you?
Just for like a little while, but then it just came right back.
Okay. So on and off for 5 years, you've been battling with this, mostly
yes.
on doing physical therapy for how long? For 5 years?
Yeah.
For 5 years.
Yeah.
Oh my God. Okay, so we need to talk about this, right? So if something's not working after 5 weeks, Houston, we got a problem. There's a problem there, and this drives me crazy. Because the physical therapist knows better. Physical therapy is the study of soft tissue. It's not the study of the sciatic nerve, and it's not the study of nerves. No. It's not. And I'm sick and tired of seeing MDs referring every time for sciatic patients to a PT. A PT can show them piriformis stretches. A PT can strengthen their core after they get over the acute sciatica. But for sciatic nerve pain, don't see a physical therapist. Stop. Stop doing that. Stop listening to your internist, your medical doctor. Go see a chiropractor. You don't need a referral to see one. We are the back specialists, not PTs. PTs are the soft tissue specialists. They can stay in their lane, that's fine. They can help with sciatica, but they're not going to help a case like her that has a disc injury most likely. Okay, they didn't even schedule her for an MRI, did you? Did they?
Yeah.
In like 5 years they have?
Ago, I would have herniated disc.
Okay, so you have to bring in that MRI report for me because I need to see that. Okay. So at least they sent her out for an MRI in the 5 years, you know? Sometimes they don't even do that, which is just startling to me. But PT is not what you do for sciatic nerve pain. Wow. Cox flexion distraction technique or just chiropractors are better equipped by a long shot to deal with sciatic nerve pain. Now, if the sciatic neuropathy is from piriformis syndrome, which most cases are not, then physical therapy can help you with that. But so can a chiropractor. So you're better off going straight to a chiropractor and skipping your MD because your MD doesn't know what he's doing. He's doing a cookie cutter approach. Oh, you got sciatica? Let's send you, well, you can have an injection, pain medication, which don't even get me started on that, or we'll send you to PT. Don't do it.
And they recommended surgery.
And then they recommended surgery without even seeing a chiropractor. And this just drives me crazy.
Yeah, they do.
So we're going to follow up with her afterwards, after we're done with all the treatment in a few weeks. But this just, it gets me going. Anyway. Wow. Some people may have gone to a chiropractor for sciatic nerve pain and said it got worse. They probably didn't follow through, most of them, if not all of them. So, and some of them may have and may required surgery, and some of those people that didn't get results may have only had 1 or 2 techniques done on them. All techniques are not created equal. So we're going to do a technique that's considered the gold standard for you, and that technique is called Cox flexion distraction technique, okay? And it's exactly for disc injuries, spinal stenosis, sciatica, any kind of neuropathy like that. So you're in the right place. And for anybody watching this, stop doing physical therapy for pinched nerves.
Wow.
Stop, please. Okay. So now we're going to go ahead and show you how we do our treatment for her next.
Something about
Yes.
the physical therapy?
Sure.
When I came out of physical therapy, I ended up getting the pinched nerve and going to the urgent care.
So a session you did made it worse?
Yeah.
Yeah, okay.
That's why I'm here. I'm like, there's got to be something more. There's got to be something different.
And make sure you bring in your MRI report
Yes,
with you next time.
I have the CD, yes.
Okay, great. So we're going to go ahead and treat her with Cox flexion distraction technique, and we're going to take her into another room. Come on, guys. Follow us. Okay, here we are. We're now going to go ahead and treat Daisy because she's in really acute pain right now. We're going to go ahead and jump to cold laser therapy. That's going to inhibit the nerve, reduce the inflammation around the sciatic nerve, and just make her feel better, quicker, faster. And you know, I'm going on vacation soon, so time is of the essence here. But we're going to have somebody here covering and treating her when I'm gone. But we're going to go ahead right along that sciatic nerve. It's her right side that's worse. So we're going to target the right side first. And the sciatic nerve comes from 5 areas. So L4, L5, L5, S1, S2, S3. And they all come together in 5 branches to form the largest nerve in the body, the sciatic nerve. So I was telling you about, I'm not going to keep harping on PT and PTs treating sciatic neuropathy because they stink at it. They might help a few cases, and those cases might have gotten better on their own anyway, you know. So I don't know. I'm going to keep that to myself. When we get sciatic nerve cases in this office, they see our PT, but only after I get them out of acute pain. Then they do PT, rehab exercises, myofascial stuff. We start right away. Chiropractors do myofascial work. Not all do, but most do. So we'll do that in the beginning here with her, and along with the laser here. But this right now is set to 1,000 hertz. So this is just going to inhibit the sciatic nerve. Make you more comfortable, okay? And then we're going to take you through the protocols of Cox flexion distraction technique. Okay. Do you have any questions?
Nope, I trust you.
Okay, I thought you was going to say yes. Does it hurt? Usually that's the first question. The second question is, how much is this going to cost me? And the third question is, how long is this going to take, usually? So I'll let you know how long it's going to take. And as far as cost, you can talk to my front desk about that. But as far as how long it's going to take, typically, you know, disc injuries take 2 to 3 months to heal. But it's not going to take that long for you to get symptom relief. So we're looking at, in the least or worst case scenario, 50% improvement in your symptoms in 4 to 5 weeks. Nice. But typically we see 40 to 50% faster than 4 weeks. So.
Can you believe they wanted to remove my disc?
Yeah, so they wanted to do surgery on her. That's what she just said. I don't know if folks can hear her. And they never. So here's the other warning sign. So they wanted to do surgery. They kept sending her to PT. They never sent her for spinal decompression or anything different. After a year or two, if something's not working, at least 5 weeks, but 2, 3, 4 months, if it's not working, try something else. And they clearly did not do that for her. Or, I'm not saying even go to another physical therapist, but in that situation, PT wasn't going to help her. But sometimes it's also a doctor match. It's just not the right fit, you know. Even between chiropractors, we've had patients here not many, but we've had patients here just not do well, and sometimes we just refer them out to somebody else that can maybe better help them, or maybe someone that's closer to them. But it's not always an exact fit too. But if something's not improving in a few months and you're consistent with your care, you got to make sure you follow the care plan of the PT or the chiropractor or the doctor. But if you're doing that and following their recommendations and you're not improving, then something's off. You need to try something else.
That's why I'm here.
Yes. Better late than never, right?
Yes.
So in a second here, we're going to do spinal decompression on her and see how she responds. Actually, you know what? I'm going to hold off on the spinal decompression because you're in acute pain right now, and I think too much sometimes is not good. Okay? So we're going to do the flexion distraction on you by itself, see how you respond to that. If it falls well, then next time I'm going to do decompression with flexion distraction. And decompression is basically mechanical traction of the lower back. Okay? We got another minute here with the laser, and then we're going to go ahead and jump into the flexion distraction technique. So first we're going to start her without the cuffs here, just to kind of take her through the protocols, make sure she doesn't have any pain shooting down her leg. If she does, then we don't want to cuff her. She's not ready for that yet. So, do you remember where your disc herniation is in your lower back? And if not, well, do you remember which level? L4, L5?
I think 4 or 5.
So what I'm doing, and just relax yourself.
I got a cramp.
Oh, you got a cramp? Where, in your back? Okay. Try to relax your head down flat, arms on the armrests. I'll help you with the cramp there. So she doesn't know exactly which level, but it's really important that when we're doing flexion distraction that we don't place the hand too low, because if we do and there's a herniation above it, they're not going to get off the table, okay? And they're going to curse me out.
We don't want that.
And luckily we've never had that happen in my 20 plus years of practice. We have not had that happen, but it can. Yeah, take a deep breath in. Good. And what I'm doing here is just softening up the QL muscle, the quadratus lumborum muscle, the multifidus, the iliocostalis muscles. It's sore, it hurts, I get it, I know. I've had sciatica. She asked me before, you have no idea what this feels like. I do. So I was about to tell you my story. So I had sciatica. I was on my way driving all the way up to Vermont from New York, and I was on my way to a triathlon. So I developed, for the first time ever, a little sciatica down my left leg.
How do you get that?
How do you get sciatica?
Yeah.
Great question. A lot of ways. There's a lot of different things that can cause it. Oftentimes, but not always, oftentimes it's a result of an injury to the disc, a bulged disc or a herniated disc. But sometimes it can be misalignment or subluxation of the vertebra, causing inflammation and irritation and chafing around the nerve. And that can cause sciatica or pins and needles tingling down into the leg. So that gives you an idea. Also, spinal stenosis can cause that, okay? There's a few other conditions like degenerative disc disease, arthritis, which you have. So arthritis increases the chance of inflammation in the joint there, in the facet joints. And that inflammation can spread out and irritate the nerve root as well. Okay, so there's a few things that can cause it, but we're going to get you through it, okay?
Okay, thank you.
And already you can feel the back loosening up a bit. Take a deep breath in. And again. Good. Now, so see how sensitive she was. Her back wanted to spasm a little bit just from doing it without even cuffing her in. So we don't have her cuffed in yet. We're just tolerance testing her right now. How you doing right now? Better?
Little.
Okay.
Don't feel that pain, but
Okay. Any pain down your leg? Any increased pain down your leg?
No.
Great. Okay, so now we're going to go ahead and tolerance test each leg here. So I'm going to start with this one, and just let me know if you have any increased pain down the leg. How about there? So you'll see here I'm grabbing the unaffected leg side and testing her, and she doesn't have any increased pain down the leg. So that's good. We're going to move on to the affected leg side. Okay. Tell me if you have any increased pain down the leg. How are we doing there?
Good.
Good?
Yeah.
Great.
I just feel it up here.
Up there, but not down your leg.
No.
Okay, that's perfectly normal. So she passed. All right, now we're going to cuff her in, okay? Now you can't go anywhere. You're stuck here now, Daisy. Okay. The other thing is a lot of people like to go get cracked, put on their side and cracked. You know, with sciatica, you know, oftentimes that will work. But it is not the most effective way to treat sciatica from a chiropractic technique. Oh, you've tried that?
Yeah,
So you have been to a chiropractor?
no, I had physical pain management people.
Try to adjust you?
Yeah, and it helped a little when they stretched it, but
So pain management doctor, MD,
yeah, well,
tried to manipulate you?
the physical.
This story gets better and better.
Yeah.
So
I
explain
tell
a
you,
little
I
further
tried
on that for me.
I tell you, I tried so many things you have no idea.
Explain a little further.
There was a physical pain management doctor
Okay.
that recommended physical therapy and stretching and massaging exercise.
Okay.
And they stretch my legs and waist and stuff because they said it was places that I wasn't using that was causing the stiffness and stuff.
But did you have leg pain down at that time?
No.
Oh, you didn't have any leg pain?
No, I had the herniated disc.
But no leg pain?
No leg pain.
Okay.
And they were just stretching me out a bit.
So when did the leg pain start? After the physical therapy irritated? Okay.
Yeah, in time, after I started resting too much.
Okay.
And they told me that if the more I rest, the worse it gets.
Yeah, sitting is what makes it worse. So sitting puts about 225 pounds of pressure on your discs in your low back versus standing. So yeah, sitting's not going to be as good. It's not the cause of it, but it's not going to be as good. So here you go. She went to see a PT for just back pain and scoliosis and had a disc herniation, and it got worse. And again, I just think chiropractors are better equipped at dealing with acute back pain, especially if it's a result of scoliosis and a disc herniation. And then after that, you know, getting started with PT to strengthen your core and stretch and get good range of motion and flexibility. And of course, chiropractic will help with that range of motion and flexibility, but the PT will help to support all the supporting and surrounding muscle and soft tissue structures. And I think sometimes they just put the cart before the horse, you know, and the horse being the chiropractic and the cart being the PT. How are we doing there? Any pain down the leg? Okay. Okay, so we're just going to do a little bit today. I want to see how you respond. I'm going to see you again in a day or two. Okay. I'm going to have you stand up here. Okay, roll. I want to show you how to get up properly. So roll onto your side.
Which one?
Facing that way. Now what you'll do is push off your elbow in your hand and swing your legs over the edge of the table and down at the same time. And sit yourself upright. Yep, and then swing the legs up there and push at the same time. There you go.
Oh, cool. Oh, Oh, yeah, much easier.
And stand up for me.
Oh.
I know you had some leg pain when you stood up, so.
Oh, nice.
Okay.
Oh,
Say hi to everybody.
Hi.
This is Daisy, everybody.
I feel a little better. And this is
Okay.
the first day.
We're going to get you there, okay? Hang in there.
Oh my
Okay, look
goodness,
forward to helping you.
Thank you,
I hope you
David.
guys got something out of this video. Thanks for tuning in.